In the previous video, I have given a short description about the entire skull. Skull is the bony part of the head. So skull is made up of the cranium part, facial part. In the facial part, in the superiorly, there is maxilla in major, and the inferiorly there is the mandible. Today I'm going to talk about the mandible. Mandible is a irregular type of bone, though it looks like a flat, but it is considered as irregular bone because the actual shape of the mandible is irregular, though it looks like a flat on either side. But if you see on the laterally, you see on the top, these are the process which I will discuss later on. These are not in proper size, in irregular, and hence they are irregular type of bone. This bone is the strongest bone in the skull. This is the anatomical position of the mandible, which this is the body, lies anteriorly. On the lateral view, the body continues with the ramus, and this ramus has two processes. This is the anteriorly. This process is called the coronoid process, and posteriorly this is called the condylar process. Now, what is the major part of the mandible? Mandible has a body. Body is U-shaped, which is anteriorly. If I pick up the mandible on this side, this is the lateral view of the mandible. The body continues as a flat structure called the ramus. This ramus has again two processes, anteriorly coronoid process and the posteriorly condylar process. This condylar process articulate with the skull, forming right here, forming the TM joint called temporomandibular joint. So this is, let's go to here. As I said in the beginning, it has two parts, a body and two ramus. These are the ramus. Right, left ramus and right ramus of the mandible, and this is a body. Talking about the body, this is the outer surface. If I check posteriorly, this is the inner surface of the body, and it has the two border. This is superior border where there is sockets for the teeth on superiorly, and this is the inferior border. Now, talking about the outer surface, there are some features laterally on here, which is opposite to the second or third, or in between second and third molar teeth. There is a foramen called mental foramen, and actually This body is formed by two symmetrical fusion at midline. This is called the symphysis menti. Symphysis menti, on the lower part, there is a triangular protuberance. It's called mental protuberance. Multi- Mental protuberance has a triangle-like appearance on here. On the base, it has a bifurcated elevation called mental tubercle. This mental tubercle runs laterally and posterior with the inferior border. Now, this inferior border on the middle, if I look up inferiorly on here, there is a fossa called digastric fossa. Alright, now talking about the internal surface of the body of mandible. Here is the internal surface of the body of the mandible. Looks like a horse shoe shaped. Alright, so on the midline there is a tubercle called genial tubercle. There are actually two genial tubercles called superior and inferior genial tubercles, and these are the small foraminals of the mandible, and there is a foramen along with the lingula is called mandibular foramen. This mandibular foramen emerges out on here into the mental foramen. Alright, now talking about the ramus. Ramus, this is the ramus, has the similar features on the both side, right and left. This is ramus, as I said before. This ramus has anterior surface. Ramus has anterior border, posterior border. Here, anterior border is continuation from the superior border of the body of the mandible, and posterior border continues from the inferior border of the body of the mandible. So posterior border continues with the forming condylar process, and there is notch like depression called the mesenteric notch, and this continues with a coronoid process. So on this surface has called the external surface, or also called the lateral surface, and this is the internal surface, also called the medial surface of the ramus. On the medial surface of the ramus there is mandibular foramen, lingula, and here the anterior aspect of the condyle process there is a depression called pterygoid fossa. So I hope this video is good for you to understand the different part and the major features over the mandible. In the next video, I'll be discussing about the pars and its attachment over here. So, till then, goodbye. See you in another video. Good luck. Take care.